Welcome to the Krista Escamilla Show.
Hello, everyone. Thank you so much for joining us for the Krista Escamilla Show. As always, I'm grateful for your time, and you're here to do three of my favorite things: listen, learn, and grow. And I know that's some of our guests' favorite things, too, so I can't wait to dive into her story. But first, I want to share our sponsors, because without them, we could not have our show. So huge thank you to Rig ID Workwear, to Kevin Foreman, Foreman Financial, Tapestry Hotel Midland, also Thin FR, and joincapclub.com. One more, Omni Midland Hotel. Thank you so much, and we ask you to just support local however you can. Okay, it's the holiday season. We are so excited for today's guest. I hope that you are ready to really just have a crash course in all things we need to get ourselves together. That's what I'm looking forward to, because I need to get myself together. So joining us today, we have first and foremost mom of four, Dr. Stephanie Caples, but she is also, need my glasses for this, Director of Behavioral Health at Midland College and Texas Tech Health Science Center, also the Clinical Programming Administrator for the Permian Basin Behavioral Health Center, and also just an amazing woman. So let's give her a big round of applause.
Thank you.
Thank you for being here today.
Thank you so much. I know it's a mouthful to say that, so thank you for getting
Well, when someone
that.
has as amazing titles as you, I want to make sure we get them all out, because I really do. I love all the things that you're doing for West Texas and helping in the mental health sector, because this is so important, and I just can't wait to hear your story and share it.
Well, good. I'm happy to share it. Where would you like for me to start?
Oh gosh, let's start at the beginning. Where were you born?
We can start that at the very, very beginning. Shout out to my mom.
Yes,
right?
shout out mom.
Yeah. So I was born in Dallas,
Okay.
Dallas, Texas, and I graduated from Allen High School. Went to the University of Texas at Austin. I know that's not really popular out here in West Texas.
Hey, there's a lot of UT fans out there.
Even
we
if
can throw
they're
this up.
even if they're
We can
not,
throw that
I
up.
am. I bleed orange. So I went to
Love
UT
it.
from undergrad all the way through graduate school. I went straight through and got a doctorate degree. And everyone asked me, like, how did you get into psychology? And
Right.
the true story, it's really not glamorous at all.
It sounds glamorous,
It's
so tell
so
us what
not
happened.
at all. I was graduating with my bachelor's in psychology after a couple of different major twists and turns, because I thought I could be this, great computer scientist. And I took a discrete math class, and at the end of the class, and took the final and realized I was so discrete. I still had not figured out what discrete math was. And so this is not
I still
the
don't
career.
know what discrete math
I still don't either. So I changed
Google
my major, right? So I changed my major, or I just dropped that one and kept psychology. So I was graduating. My dad says, "Great, you can get a job now." And I said, "No, I can't. What can I go to school for the longest amount of time?
Right.
So you can continue to pay for my
I
education."
love it.
Yeah, not glamorous, but that's what happened. So I got a doctorate degree in psychology, and I was just fortunate enough. I think it's a God thing, because I really don't ever feel very qualified for the steps that I've taken, and that's how I know it was God's path for me.
I love that.
Yeah.
I love that you feel that you recognize it, because
yeah.
I truly believe that everything happens for a reason.
For sure.
And so no matter what that path was to get there,
Yeah.
God had a plan.
He had a plan, and when you trust him and just kind of stumble upon his plan and let him guide you, you end up here. And it's been a phenomenal community for me. Coming from Dallas and Austin, I've been out here 16 years now, and it was
wow.
supposed to be 1 year, and it's 16 years later.
That is a familiar story
It
that I hear.
is.
I was the same way. I was 2 years. I thought I was going to do my 2 years time.
And then
fell in love with it, and
Right.
have been here
and
ever
then you
since.
stay.
do.
And then you raise your kids. It's a great place
It
to raise
is.
kids.
Absolutely.
I was so fortunate enough to graduate from school with my doctorate degree, and then I went straight to be a professor at Texas Tech,
Oh, wow.
the Health Science Center in Odessa. And
So that was your first job,
that
right
was my
out of
first job,
right out of
my
college.
first real job, first real paycheck.
Love that.
Yeah, right out of graduate school. And so I stayed there. I'm technically still there, obviously, but I
Right.
stayed there full time for 14 years before transitioning over to work with Russell Myers at the Behavioral Health Center.
I love that. What was it about psychology that really hooked you in the first place, that made you go, besides you could get a degree and stay a long time?
I was like, well, I just told you what it was.
Stay
There's
a
not
long
much
time.
else.
But what was it that hooked you? Because, just because you get a degree doesn't mean you stay in the field.
Right,
So
right.
what was it?
It was the ability to connect with people, and this is a career. When you're doing clinical work, the therapy work, I don't do that anymore. But when I was doing it, when I first became licensed, I realized it was so humbling and honoring. People let you into aspects of themselves, which is how they think and what they feel, that a lot of people, even in their family, don't get exposed to.
Right.
And so to have that responsibility and that ability to connect with people on that level,
Right.
I took it seriously and I loved it. I was able to see people because I was a clinician at Texas Tech, and it was just a variety of different backgrounds and ethnicities and socioeconomic status. So I wouldn't have been able to interact with these people on this level,
Right.
but for that. And some of my most favorite people that I worked with were so vastly different
I bet.
than me in so many ways, you know. So
Well, and what a great way to really connect with people and help people, and then learn, like you said,
Well,
from the others that you're there with.
right. Well, and what a lot of the people that I worked with, I mean, at Texas Tech, we call them patients, obviously, right? If you're in a community center, they're called clients, whatever. So those terms you'll hear me used interchangeably, but they were helping me.
Yeah.
It was cathartic for me too.
I love that.
Yeah.
What did you learn that first year? Because I feel like the first year in any career is so, eye-opening, really, that you go, wow, didn't see that one coming. Or, what did you learn the most that first year in being a therapist and helping others?
That I was more confused than anything else.
I love the honesty.
Like, I don't know. I learned to embrace my flaws. I don't even like the word flaws, right? Because it just makes us a little colorful.
Right.
Just a little sparkle.
Right.
But I learned to give myself grace by helping others find the grace to give themselves. But I did. I learned I was confused and didn't have all the answers. But I learned I didn't have to. Because I think when you're a first year out of a doctorate degree with your, clinical status, people are looking at you to have the answers, but you put the pressure on yourself that you should just know everything.
Right. You're like, I have this degree.
I
should know exactly what to
they
tell
are
you.
calling me doctor. I know what's wrong. I know how to fix it.
Yes.
And most of the time in this field of medicine, really no field of medicine, do you know exactly how to fix it, right?
Right.
But if you think about therapy and psychology and psychiatry in this field, it's really the only field that we don't get labs and x-rays and imaging to tell us to solidify diagnoses.
That's true.
Right?
I didn't think about that. You're right.
But it's all based off of what someone's telling you. And their perception's their reality. But if they don't feel good or they have a thinking disturbance, then their perception is skewed. So how do you do that?
Yeah, how do you do that?
Right.
Yeah, really, that's hard.
That's what I learned. Like, this is hard.
Wow.
But
I can't
it
even
is
imagine.
so amazing. And so I think that's where the human side comes in. Does it really matter what label we put on what diagnosis? For the insurance companies, it does, right? But understanding them, how they function, how they see the world, how they connect with other people in their lives, and helping them heal their hurt places, right? Because no one's being maladaptive or dysfunctional or mean or angry or hateful because they want to be.
Right. It's never on purpose.
No, they're hurting,
Right.
And so
isn't that true? Hurt people hurt people.
Absolutely. Okay. No one is really just misbehaving. There's always a reason, right? And so if you can understand them in their context and understand how they see themselves, and help them see themselves the way you do, it's so powerful.
I love that.
So powerful.
What a amazing, fulfilling career I bet it has been for you.
Amazing.
What advice would you give to someone that, we're going to go from two different angles. From first question, from a family member that goes, okay, I feel like my loved one needs help, they don't want to get help, or from yourself, I know I need help. Yeah. What is the next step? Let's tackle both of those because I think that's important for our listeners.
Yeah, and you might have to remind me because I start rambling.
No, I do too.
I might not come back around.
We may have to ask Al. Al, remind me what I just asked twice.
I'm like, what are we talking about here? So the first question was for a family member, right?
Yes,
so if you have a family member that you feel like is struggling, and a lot of times we know, but we don't know how we know, and we won't ask the questions, right? So we know, what I often tell people is look for changes in their behavioral patterns.
Okay.
That's a pretty good indication. Sometimes somebody's, if they're bubbly and then all of a sudden they're isolating, right? Different things like that. They're okay and then all of a sudden they're irritable. And I'm not saying for a day.
Right.
I mean,
because we all have bad days.
Right. And so, but I mean, if you notice it consistently, but I also don't mean for 6 months. I mean, 2 weeks without improvement, because what happens is normally we get into a bad mood, we have a bad day. Depending on what has caused that for us, it remits on its own within a day or two, right? We start feeling better about things, whatever. Right. When you are really suffering, it doesn't go away in a couple of days. So
you're looking at weeks at a time.
Yeah, so if you notice that your family member's behavior has changed, and I hate to use the word negative, but in negative ways, negative meaning more irritability, isolation, sadness, or if they were like that and all of a sudden they're happy. So we're looking for big shifts. People don't think about if you're too happy that's a sign too.
Right.
But it is. So we're talking about big shifts in mood or behavior changes.
Okay.
That are about, I say 10 days. I'm pretty conservative with that though,
Okay.
because to me, the earlier we can catch something, the better. Kind of like the flu. You have to take Tamiflu within the first 48 hours.
It's true.
Kind of the same thing. We call it mental health, but it's all physical. It's all physical.
It is.
Right?
It's all interrelated.
It's all interrelated. It's not mutually
We'll tackle
exclusive.
that later. I want to talk about that again.
Yeah, and
we'll circle back
and if
there.
you think about it, it's physical too, right?
Yeah.
So anyway, so it's very similar to physical health components. Earlier detection, better. So you've recognized this. I think one of the important things to do is we are so afraid to talk to even our spouses and kids about what's going on because we're afraid that we'll upset them.
Right.
They're afraid that they're going to upset us. I think you just got to put it out there and say, hey, I've noticed that you're different. What's going on, allow them that space. But if you allow them that space, you're not on your phone while they're talking to you. You're not being judgmental. You're not jumping in telling them what they need to do.
Right.
You're listening.
You're not trying to fix it, whatever the issue. You're trying to help in a, I don't even know what the right words, you would know
Just
better.
identify it.
Help identify, okay.
Right. Yeah,
And
you
then
just want to identify that with them, not for them.
Yeah.
Right? Or allow them to tell you what they've already identified. Because sometimes people know. They're just not going to say anything. And so I think the important thing about seeking that information, hey, you're different, what's going on, is to listen non-judgmentally. And that's hard.
it can be hard when it's your family.
It can
right?
be. It can be. And depending on what kind of relationship dynamic that is too, right? Because as a kid, if it's your child, you think about it one way. If it's a parent, you think about it a different way. If it's sibling, right? So all of our relationship dynamics are very different depending on that relationship. So
And this will be a 5-hour podcast. No kidding. Because we got to
so
dive into
detailed.
all of this.
This is so detailed. Maybe let's call it part 1.
yes. Well, I love
part
it
one.
because it is. There's so many dynamics.
There's so much that you have to pay attention to and be
Right.
aware of, or at least just be aware of, right?
So what are the words that you say then when you do want to help? So then
Yeah.
we've identified the 2 weeks,
So
something's going on. What are the words we use?
So I would, if I were coming to you, I'd say, Krista, I noticed you're different. Are you okay? What's going on? Can I help with anything? Can you tell me what is going on? Because you are different. And I would tell you, I've noticed that you're a little more irritable than you normally are.
Right. Is it because you recognized it? You recognize the different behavior. So just
Recognize it. And
so
then,
be honest.
Right. Be
Okay.
very honest. And you can label what that different behavior is. Because
Right.
I can say you seem a little more irritable than you normally have been.
Right.
And if you're not irritable, you don't feel irritable, you'll correct me and say, I'm not irritable, I'm sad. Oh,
Okay.
great, even better information.
Right, because now you're getting them to talk.
Yeah,
Okay,
exactly.
and then it trickles from there.
Right.
At what point then do you suggest therapy or suggest talking to someone? If they're not open to talking to that family member about it at all.
Right. So I would, a safe place to start, because let's just be real, even though mental health has come a long way since COVID, a lot of people are paying attention to it now.
Which is
and
great.
it's so amazing. It's so
amazing.
great. But we're not there yet as far as reducing the stigma.
Yeah.
Right? So it's okay for us to talk to somebody else about their mental health, but to talk about ours, right, can
Right,
be hard, or
right.
our family members. So then you can say, well, let's go to the doctor. You can go to your primary care doctor. That feels a little less intimidating.
Yeah, that's
to
a
lot
great
of
idea.
people.
I love that.
And talk to the primary care doctor about it. You can go to the church, and a lot of churches have counselors that are not the pastor. Some people are intimidated to go to the pastor, right,
Right.
for counseling. So there's community centers. So once the person identifies what is going on, or I'm a little sad or whatever, I think you say, well, I've noticed it for a while, and so I think we should just go talk to the doctor. Let's just go to the doctor,
Yeah.
or let's just make an appointment at the church and just have you talk to someone and just try it. If you don't like it or you don't like them, no big deal, right? So
Right.
you're making it very easy and not a permanent thing. You're not making it seem like something's wrong with them, right?
I love
And
that.
okay, we're just gonna try it. It's one appointment. See what you think.
Good. I love that.
Yeah.
And would the same go for yourself? If you're noticing in yourself the same steps, is that what you would take?
Yeah, it is. And I have before. So the very first time I had some trauma after my last kid, and my doctor, who's my really great friend, she was like, something really wrong with you. You need to go to therapy, because I had trauma, right, from it. And I was like, I'm fine.
Right.
Me of all people.
You're like, I can do this. I can
got
heal
this.
myself.
I got
Yeah,
this.
right.
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 didn't happen. So then I was like, okay, she's right.
She's
But she had to say something, right? Which is why you hear all of the see something, say something slogans, because
Yes.
it's important. And so she was saying it as my friend, not as my doctor, right,
Love
at that
that.
time. And she didn't force it. She just said it that once. But because
Right.
she was the one that said it, it was in my head. Well, of course I need to go right then. Duh.
Right.
I'm not going to do that.
But she
I went
planted the
later.
seed for you.
She did, yeah. And
Yes.
so I think it was maybe a month or two later where I was like, okay, I'm still not okay.
Right.
And it was so scary. And then, you have the challenge in my position of being like, this is what I do. How is this going to be
Right.
helpful?
Right.
And then who do I go to in the community, right? Because COVID hadn't started the whole online therapy thing yet.
Yes.
When I needed to go, and I just said, I'm so tired of feeling like this.
Mm-hmm.
And I bit the bullet, and I told myself the same thing I told other people: one appointment, just go once.
Yes.
And I'm driving over to the appointment. I'm like, I'm not going to have anything to talk to her about. And
But you did?
I was like,
love
dang
that.
it. Has it been 45 minutes? I just started. Can I have a
we
little
just
bit longer?
scratched the surface.
Right.
Can I
Do you
get
have
you for
anybody
2
after
hours?
me? Exactly. And then I look forward
I
to
love
it.
that.
And so I finished my work for that trauma. But then now every once in a while I'm like, okay, I need to go back.
Yeah.
You know what I mean? Just as a refresher, as maintenance. And now there's a lot of options. Now you can have coaching and life coaching. You know what I mean? You don't have to
Yes.
go to a psychologist, a doctor. There's so
Right.
many different options now.
It really has. So, I mean, if one good thing, right, came out of COVID was that there was more online
Yes,
services
yes,
now available
yes.
because, and we'll get into this, why we need this new center,
Right.
but there really, you couldn't get in to see somebody
yeah.
because because it was during COVID,
Right.
and then B, we just don't have as many mental health professionals here in West Texas
That's
that
right.
we needed.
Mhm.
So out of that, a lot of good conversations and a lot of work on your part, I'm sure, this new Permian Basin Behavioral Health Center, did I get it all right?
You got
Yes.
it right. She did. It's a mouthful, isn't it?
It's being built,
Yeah.
and that's amazing.
Oh, it's so cool.
Oh, tell me
It's
about that and
so
how you think
cool.
that's going to change the landscape of West Texas.
So the Behavioral Health Center was a vision, and I think the brainchild and a love child for Russell Myers. Years and years ago, I think he had this vision, and he was alluding to it way back then with me. And he started laying the groundwork all before I was even involved in it. And so then in 2022, he asked me to join the project, and I said, I don't know how to do that. I don't
Right, there's
think
not
I
a center like that
can,
here.
but you can't tell Russell Myers no. Like,
True,
who does that?
Right.
Like, I'm not the brightest one, but I'm not dumb either, so I need not to say no.
Like, if he's asking me, I'm going to go talk. Yes.
Exactly. And so he told me, I don't know how to do this either. We have to figure it out together,
Right.
And so from his vision and being able to have the experience of being a clinician in West Texas for 14 years, I knew some of the elements of what I would have liked to have seen when I was still doing the clinical work, right?
Right.
What people needed, where the gaps were. I was able to identify some of those, not all of them. We still can't identify all of them, right? Because we just don't know. That's why they're gaps.
Right. And you saw the needs more than anyone because you were in there.
I was
in
in
the
there.
trenches. Right.
I was in the
Yeah.
trenches, and it lived the frustration with the people I was treating, because I told you I get overly involved and connected, and so I lived the frustration with them, and so it has really become a passion project for me as well. And so we have a great team of architects and consultants and all, but right now there's 3 people full-time dedicated to the Behavioral Health Center, and that's Russell and myself and our coordinator, our project coordinator, who's
That's
phenomenal.
wonderful.
She joined us in July, and she's great. And so to be designing and building this $225 or $30 million facility and 220,000 square feet, and being
And
able
how many
to
rooms? 200?
200 beds.
200 beds, okay.
Yeah, so that translates a little differently because into rooms, right? Because we have
Okay.
some private, some semi-private.
Gotcha.
But we have
So
200 beds. But we have a crisis center, which means if you think you're having a problem or somebody in your family is, a lot of people go to the EDs right now, right? So they go to Midland Health or they'll go to MCH, the emergency department. And then you got to sit there for hours,
Yeah.
right? Because you're not considered the priority, because you're not having a breathing problem or a heart attack or stroke.
Right. Or you're not bleeding and it's
Right.
not, you can't see it.
You can't see it, right? But I could be in full panic internally. Most people that are in full panic crisis mode, it's
Yeah.
all internal and you can't see it. But
Wow.
but because they can't identify that readily, then you have to sit and wait. Well, the Behavioral Health Center will have a crisis observation center. So you come into us and we have an immediate assessment done for you. And then we can determine the appropriate but least restrictive level of care. What that means is not everyone that comes in crisis, panic, suicidal, homicidal, psychosis, intoxicated or whatever, needs inpatient care. About 65% of crises can be managed on an outpatient basis. You just got to stabilize them, and then they're managed outpatient.
Gotcha.
So a lot of people don't know that, right?
Right.
So our goal really is to keep people out of the hospital, not
Right,
keep
not
people
in it.
in
Right.
the hospital.
You don't want to see the hospital full.
We
right?
don't. We
The-
will at times,
Right.
but that's not the goal. So we're starting with the behavioral health center with the crisis and the 200 beds. There's going to be an interventional psych space, which means like ketamine and TMS and ECT, those really effective treatments, but you have to do them under a doctor's care to be effective, are going to be there too. The Texas Tech University Health Sciences Center Psychiatry Department, their local psychiatry, is going to be our medical service provider. So they'll provide the psychiatric services. And then we're going to have partial hospitalization and intensive outpatient. What that means is sometimes when you get out of the hospital, or if you maybe don't even need to go in it, but you just need more intensive care. So a partial hospitalization is typically about 5 days a week for about 4 to 6 hours a day, right?
Yeah.
So you can kind of see you're at the facility, you're at the center, getting your intensive treatment. And then you can step down to intensive outpatient, which is a couple of times a week for a couple of hours.
Okay.
So right now what happens is you get out of the hospital and they're like, follow back up with your provider. Well, whoever that is and whenever that is.
Right.
And nobody tracks it. We don't know. We don't have a clue what happens to these people unless and until they come back to the ED,
Wow.
right? Because it might be 3 months before they can get into their normal provider if they have one.
Right.
Right.
And so they feel so alone once they leave.
Right.
And then chances are they don't come back.
Unless they're back in crisis.
Back in crisis.
Right?
Right.
So kind of a similar system to physical health. Remember I told you it's very similar to
Yes, it
physical
is
health.
very similar.
Right? And so it's not too different. So we're closing the gap with the partial hospitalization, the intensive outpatient. We will have Permian Care and Texas Tech Psychiatry located on the second floor, so their outpatient services are there. We'll have case management. So you
That's
will,
great.
when you leave, you'll have your meds, and you will know when your next appointment is. And hopefully my goal, people look at me like I'm crazy, but my goal is you will have met your provider if you don't know them already.
I love that.
Before you've even left. Because when people can make that connection, right, even if I don't see you for another week, I've already had the chance to talk to you. I've seen your face. I see what you look like. It doesn't
Right.
feel as scary.
Right.
So I'm more likely to show back up.
That's a good point. I love that. Well, I don't think you're crazy at all. I think that is amazing.
Well, it's going to be difficult to pull off, but it is a goal.
You can do it.
Yes, I can.
I've only known you a short amount of time, but I know you can do it. You can do it. This is going to be such a blessing for our community because it really is going to trickle down. I think physical and mental health, they really go hand in hand. And for so long, we've just focused on physical. So now
That's
it's
right.
so wonderful
That's
to
right.
see the emphasis being on mental because we're all just better together when they're all working together.
We all got to do it together, and all of our bodies work together. And, the number one thing that goes awry, let's say you have a chronic physical health condition, diabetes, hypertension, whatever. When you don't feel well, as far as depression goes, you stop taking care of yourself. So all of that gets worse too.
Right.
You know?
So then again, the mental can affect the physical.
That's right.
Just a big cycle.
It
Yes.
is. It's all in there together, and we got to take
Yes.
care of all of it. You know, and we have this big initiative going now to bring mental health into preventative care, which is primary care, right? To work on it the same way that you're tracking people's thyroids and blood pressure and controlling asthma and doing all these things to set up preventative care.
Right.
We need to do that with mental health too.
I love that.
which is
How do
really
you
great.
do that? What does that look like?
So it's started already, and we do need to improve the quality of it. But like the American Psychiatric Association, American Pediatric Association, the associations that lead for OB-GYN, like gynecology and obstetrics, they have already started recommending putting in depression and anxiety screeners in their annual visits.
Okay.
But we need to take it a step further. And so we've developed a project. It's a collaborative care model. I've kind of tweaked it a little bit. So it's not new to America. It's new to West Texas and Texas. And I've tweaked it to try to improve it a bit. But what we're doing is we're putting behavioral health or mental health clinicians in primary care offices and having them talk to everyone the physician talks to. I don't care if you're there for strep, diabetes, whatever you're there, flu shot.
Checking on your mental health
get
when
to-
you're there.
While you're there
I
at
love
that appointment,
that.
they will come in and talk to you, do a brief screening. Just planting that seed.
That's
So,
awesome.
yeah,
I love that.
yeah,
Way to
we're
go.
working
Way to go
implement
to
that.
bring that. I love when you see a need is not being met and then you can change it and make effective
That's right.
change. That is awesome.
That's right.
We do something called quote of the day. We're going to
Oh.
take a quick little break.
Oh,
so
fun. Good.
yeah, this is just like a fun way to you're going to pick one out and then read it and tell me what it means to you.
Oh, that's on the spot. Ooh, smart. Can I pick another
Yeah,
one?
because you are smart.
Can I
No, you're
pick
so
another
smart.
one? I just told you
I'm
I'm
just sitting here in awe of all the things you know. I am learning today.
Oh, goodness
But,
gracious.
Yeah, so what does the SMART card say?
Okay, so SMART says, I don't have my glasses, but I'll
Oh,
see. When you arise, when you arise in the morning, think
Yes.
of what a privilege it is to be alive, to think, to enjoy, to love.
Marcus Aurelius. I love that.
That's perfect. That's
What
so
does that
wonderful.
mean to you?
You know, my life.
Oh,
Yeah. Before we started recording, I told you I don't have bad days.
yeah.
That's, I don't have to when I wake up. Because of the trauma I mentioned before, I do have anxiety still.
Mm-hmm.
And so my anxiety is cognitive. Anxiety can be cognitive or physical, right?
Mm-hmm.
Or both. So mine's cognitive. I start thinking of all the things. And it feels so scary in your head, right?
Right.
First thing in the morning, it feels like a big deal.
Right.
And I was listening to a podcast, and the psychologist on the podcast was like, just sit up. And I was like, really? Because when I wake up with the anxiety, typically it's before the alarm goes off. And
And you're just laying there
and I'm just laying there
in it.
suffering, like, oh my
Yes.
goodness. But then I have this other thought that I really have the coolest jobs in the world, and my life is so great right now, and I'm living my best life. Like,
Right.
40s have been amazing, right?
Yes.
And so I start this internal battle, and I don't know what to do with it. So now that I sit up, I go to that space.
Oh, I love that.
Yeah. The
And
arise.
The
right?
rise, yeah. And once you do, and once you get going, it's not as bad as what you were thinking 5 seconds ago,
Not
right?
even kind of.
Not even,
It just kind of seems like it all just melts away. And even if I still have those things in my head as part of my to-do list, because
Right.
I do, I've got 15,000 things going on at once. You tackle them just a bit at a time, right? And so all the skills that I've learned, the maturity that's kicked in, the relationships, the people I can identify to go to that are on the team or just part of my support system, it all makes it better.
I love that.
Yeah.
I feel very similar to you. I'll wake up, I'll think of, I just start with gratitude. And then once I start with
Yes,
gratitude,
that's
it's just
exactly.
like, it's so easy to pop out of bed. And there's she's a podcaster and an author, Mel Robbins.
Uh-huh.
Are you familiar?
Yep,
She has
yep.
the 5-second rule.
Uh-huh,
And
that's
she
right.
says, you just count down backwards. And that works.
It does
if
work.
you're laying
It
in bed
really does
and it's
work.
been 10 minutes, 15, 20, 30, however long.
Yes.
I swear by it. You just count down from 5, 4, 3, 2, 1, and sit up and get up, and you get going.
That's
Al's
right.
seen it, right? I do it. I say, let's go.
I wake up in panic.
I used to too.
Yes.
Until I would sit up.
Sit up.
5 seconds and just sit up.
So don't lay there in
That's
it.
right.
I
It all
love
gets
that.
a bit-
Oh,
yeah.
that's great.
Yeah.
That is great. What
So-
is a quote that you live by? Do you have a quote?
Get it, girl.
Oh, I love it. I love it. Get it, girl. That is going to be playing in my head all day.
That's what I have to tell myself. Just get it, girl. Because you know
love it.
when you're doing things,
Yes.
right? When whatever it is that you're doing, that self-doubt starts to creep in.
Right. And it happens
Right.
to everyone.
That
Have you ever walked in a room and you
everybody-
go, do I belong here? Yes, you do.
That's right.
Yes, you do. Get it,
You
girl.
do.
I love
Get
it.
it, girl.
I
And you know,
love
you
it.
don't have to be the smartest one in the room. I don't really want to be the smartest one in the room.
I never am a smartest.
I'm always the most confused in the room.
But you're
But-
right. I don't want to be. I want to
don't
learn.
wanna-
I want to
yeah,
learn from.
I don't want
yes.
to be. But you know, when you have that anxiety and that need to know and want people to know, you can almost feel like you need to be the smartest person in the room.
Right.
When you can let that go and just say, "Get it, girl."
Yeah.
You know,
Yeah.
you don't have to be, and then that way you're learning.
I love that.
Right? People
Yes.
don't have to have the degree that I have. I told you
Right.
that I learned the most from the people that I used to work with.
Right. Was there one person, because I believe in mentorship and learning from others that we work with. We just had this talk with our son that it's good to be surrounded by a team of people that you can learn from and that
for
you
sure.
can make you better.
Right.
What was one thing, or it could be several, that you learned from the people that you worked with that still sticks out in your mind that you use to this day?
Oh man, there's so many. So I was so fortunate in my career to have professional mentors, right? And a lot of them informal. So I when I first got to Texas Tech, I had 2 women physicians who served as informal mentors. And they just believed in me and poured into me. And so it wasn't any particular thing, but you can do this. I mean, it was really them just being, yes, you can do this.
Right. But
The
you needed
most-
that at
I-
that time.
Oh, I needed
you know?
that. I needed that.
I think those people come, I call them earth angels. They just
Yes.
come into your life at
Yeah.
the right time.
Yeah, I absolutely did. The people that I would see as my patients, they just the way they would say, "You get it, you get me." That was probably the most rewarding
I love that.
and the most affirming for me because remember, so many of them were so different from me, and at the beginning, they may not know how to take me, and I didn't know how to take them, you know,
Right.
and the connection that was formed, and people saying, no one's ever done this for me, and you've helped me do these things, right? So that was instrumental and taught me that I am in the right place using my spiritual gifts. That's the best lesson ever.
That is the best lesson
Right.
ever. That is to when you know that you're in the right place at the right time.
Yeah.
God has just blessed you so much.
Right.
I love
yeah,
that.
my patients taught me what my
Yeah.
spiritual gifts were. And so then transitioning into the Behavioral Health Center and working with Russell, he's literally the GOAT of all leaders. I think he probably thinks I'm a nut because I just sit back and watch him. I just watch everything, right? Because
You're learning. You're watching. You're learning.
Because I'm trained on body
Yeah.
language. And so one day I told him, I said, you would probably be really scared if you knew how much I watched you. He was like, don't tell me.
That's funny.
Because when you find someone, and I mean, I've had my boss at Texas Tech, his name is Timothy Benton. He was so brilliant, and he thought 15 steps ahead of everybody. So picking and choosing, you know, from the different people that have been in your life to lead you in some way.
Yes.
Particularly like the patients I was talking about. I can't name just one thing or one, because so
Right,
much
so
of it
many
has influenced and impacted me.
I love that.
Yeah.
We're going to play a game called Favorite Things later.
Oh, okay.
But first I have another, something different that I usually don't do, but I reached out and asked some different people. Do you have a question? I have this
I like
amazing,
that.
I was like, I got this because we were in a meeting one day
Yeah.
and you just took questions from people.
Right.
And I love that. And we'll preface it with that she's not your doctor. And
Because it's not real therapeutic advice. It's just my opinion.
Yes,
Can we do that?
yes, we can say that.
Okay.
But I asked some people for some questions for you because
Great.
I thought this would be fun because especially with the holidays coming up, we're
Right.
going to be doing a lot of peopling.
Lots of people.
And so I just thought it would be fun to ask you
Sure.
some questions from some of our listeners. So
Great.
that's what we're
That's
going to do.
great.
And just a reminder, sometimes I like to just let everyone know, we are sitting here today with our amazing guest, Dr. Stephanie Caples in Midland, Texas. We have listeners all over the world now. So let's say hi to hi listeners
that's
all
so
over the world. Thank you.
amazing.
Come to Midland, come
That's
see
huge.
us. And so we are just having a great conversation about mental health and all the wonderful things that are growing and happening here in West Texas. So now we're going to talk about the first question, family functions over the holidays. How do you address when there are differences at the table, right?
Right.
And it could be anything. There's a rule in our family. You don't talk, what is it?
Politics.
Sex, politics, and religion. You don't talk about those three things. Is that a good rule?
I like it.
Okay, good rule.
It is okay to have boundaries. It's not touching some of the stuff.
What advice do you have for our listeners as they
Yeah.
go into the holidays that could really help them because we want this to be the most wonderful time of the year.
Right.
So-
This is my favorite time of the year.
Me too.
It really is. It puts me in a good mood.
Yes.
But it doesn't for a lot of people. A lot
Right,
of people
not
are
everyone.
very stressed out because of the family dynamics.
Right.
So I think it's really important to, first of all, give yourself permission and grace to understand that some of these interactions are going to be anxiety provoking, right? If you have a difficult relationship.
Right.
I think it's important to determine if it's healthy for you to go and engage with the people. There's an idea that just because people are family
Right.
and they've invited us that we have to, if it's going to cost you more than you have to give,
Yes.
you
Don't
may
go.
really want to consider not going.
And
if
that's good
you-
in everything, not just holidays, right?
Everything.
Like in
everything.
general. if
You
it's-
have to be careful. There's a slippery slope, though, right?
Okay, what's
then
the
you
slippery
can,
slope?
Well, then you can just avoid everything. Because then you can tell yourself, this is going to cost me more than I have to give, so I'm
Right.
not going to go, right?
Stephanie
I'm
said
not
this
going to
will
work.
cost
Yeah, so I can't go to work today. It's going to cost me more than I have to give today.
You're right.
I'm
There's a
not going to
slippery
church.
slope
I'm not
there.
right. And what I mean by costing you more than you have to give, if this is going to impact your functioning for over 24 hours, let's really, and when you
Okay.
think about the word impact, so emotional content should influence us, right? It should have a reaction.
Right.
Things can hurt our feelings.
Right.
It can make us frustrated. It can make us angry. But normally we move through that pretty easily. We can
Right.
distract ourselves. And when you go back to think about it, a couple hours later, it doesn't feel as bad.
Right.
An impact is very different, right?
Yes.
An impact tingles. It lasts. My hand
Yeah.
is tingling
Yeah.
still, right? It still hurts. This hand hurts too. Guess what? And so does this one.
Yeah.
That's an impact. That means too many emotions are involved in that, right? And
Right.
if it's going to leave an emotional bruise, an emotional scar, let's
Too big
consider
of an impact.
too big of an impact.
Yes.
Right.
Then maybe back off.
Then we back off.
Okay.
If you feel obligated, sometimes you're obligated, then
Right.
it's perfectly okay to put time limits on it,
Okay. I like
right?
that.
And you inform people of what you're going to do. You don't ask for permission if you're an
Right.
adult.
Right.
Let me preface that. I don't know if you have any
If
kiddos or
you're
a teenager
10,
or
listening,
16. You still have to do what your parents
do what
say.
your parents say.
But
You're staying
if
the whole
you're
time.
exactly, so stop. Yes, we're moms, remember?
Yes. Yeah, we're gonna get into the mom and
Yeah,
thing
exactly.
in a
I'll
minute.
give you the look.
I can't wait. The look.
Stop. But if you're an adult, you can say, Mom, I'll come, but I'm gonna leave by 6.
Okay. So set
And you
boundaries.
you don't have to explain yourself. You can frame it
Mm-hmm.
by saying, this is what I'm gonna do, and make it time limited. And so, because if you think about it, most of us can do anything for 2 hours.
Right.
Right?
Yeah, absolutely.
So just because it's Christmas Day, why do you have to stay all day?
right.
You don't have to.
You don't. I like that. Set your boundaries.
Yeah.
Okay, perfect. Okay, next question. How do you deal with a narcissist?
Oh my goodness. Wow.
That's a big question.
I don't know why I didn't expect that question, because everything is all about narcissism. I totally should have expected it, and we don't have 3 years to talk about this. We probably have 3
A couple
minutes.
hours if we had to, but not 3 years.
Right.
Yeah. That
Well,
is a big question.
It is a big question. So here's the deal.
Okay.
This is a hot topic. This
It
whole
is.
idea of narcissism.
Yeah, what is it? How do you explain
Yeah,
it?
and that's my thing. Not everybody's a narcissist.
Right.
Just because whoever you're interacting with is self-centered or manipulative or rude or doesn't mean they're a narcissist.
Right.
Now, remember, I'm coming from the textbook classic diagnostic. Narcissism, according to APA, which is American Psychological Association, is a personality disorder. I mean, it is intricate, it is detailed, it is full of symptoms. The symptoms come in the form of thought disturbances and behavioral disturbances, right? And Freud, if you believe in the history of psychology, Freud
Do
says, of course, yeah,
Okay,
I'm Freudian by theory, by training.
Yes.
Freud says that it comes from an overactive superego. Basically, what that means is you have a lot of insecurities and you're overcompensating for them.
Oh, so that's why they act like
It's an
that.
inferiority complex.
Ah,
Right. So
okay.
then people with true narcissism it's so complicated because they can be extremely charismatic and really likable people,
Yeah.
right? But the way that they think, they cannot tolerate disturbances in thought that differ from theirs. What that means is if you have a different opinion, right?
It's their way or the highway.
It is their way or the highway. And long story short, and it may not be like that every single instance, but
Right.
but then what happens is then they will cut you off, right?
Okay.
Because so people in their family are then seen as extensions of them. Like, so if you are a child of a narcissist, you're an extension of that parent. That's how they see you, and that's how you stay in their good graces. But as soon as you major in something that they don't want you to major in, or you quit playing piano, then they cut you off. And it's really, really hard to tolerate.
Wow.
And difficult.
Yeah.
But with that being said, everybody thinks everybody in their life is a narcissist. Like, he's a narcissist. If you don't agree with me, he's a narcissist.
He's an narcissist. So you think it's an overused word right now?
Oh my goodness. Oh
Yeah.
my. Yeah.
Yes.
It's a little frustrating.
Right,
'cause
I
it's like-
bet. Yeah,
Yeah, because it's like, no,
you know what a
And then
narcissist
you have to spend
is.
time, convincing people that their loved one is really not a narcissist. Sure, they're selfish,
Right.
but they're not a narcissist,
Gotcha.
right? But then, like, you're getting me on my soapbox. Whoever asked this question, I'm totally on my soapbox now.
This was a good question.
But when you think about our society and how inwardly focused, that's the way I say selfish without saying selfish, inwardly focused. When you think about inwardly focused, we all are. With social media, we put on social media what we wore today, what we're eating. Like, who cares about what you're eating?
Nobody cares.
Nobody cares what trips you're on, the fact that you love your husband, even though we all know you hated him yesterday. I mean, it's just like everything is so self-centered,
Yes.
right? And
Yes.
we like look at the amount of likes that we have.
Right.
So then everybody gets a trophy. We think about raising kids. I don't know if you experience this because we're in the generation where everybody didn't get a trophy.
Right.
Now you get a trophy if you didn't do anything.
Right,
Like,
you
what
just
is
showed up.
that about?
Yeah.
Like, are you?
Oh, I'll get that'll
Like-
get me on my soapbox. Yeah.
So we are in a
Yes.
society where everything gets rewarded and it's all about you.
Right.
So of course we're gonna think everybody we're dealing with is a narcissist.
Right.
They're not classic textbook narcissists. Not everybody. I can't remember the prevalence rates, but a few years ago it was like 7% of the population or something. It's low.
Right.
Now all of a sudden 95% of the population is narcissist. I don't think so.
Right.
Not the true form.
Right.
Selfishness, sure. The problem is, I think we need to bring back altruism. It's one of the most natural defenses against depression and anxiety. It's just doing something for somebody else.
Yes, do for others.
We don't do that anymore,
No.
which is why we're all selfish and anxious and angry and depressed, right?
Right,
Because we're thinking
right.
about ourselves and we didn't get as many likes
Right.
as Sally got on hers, but we look cuter in our shoes than she
How
looked in
come
her.
we didn't? How come she's doing it
How
over
does she
there
have
and I'm
3,000
not?
followers and I've
Right.
got 600? I mean, really?
Right. It doesn't
Right.
matter.
Right.
No.
Right. So to answer the question, let me go back to that because I went
Okay.
off on my soapbox about narcissists
How
and
to deal
what
with
they
a
are.
narcissist over the holidays.
So I think what's really important is if someone is truly a narcissist, okay, there is a difference. So if
Right.
they're truly a narcissist, let's say they've already gotten the diagnosis. They legitimately have a diagnosis. Well, is it going to cost you more than you have to give? Now, remember, most of the time, narcissists are very fun, charismatic, lively people,
Yeah.
right? Because they have a big personality,
Right.
right? Because they're
Right.
overcompensating. So go into it with the idea of, I'm just going to have fun with them,
Right.
right? Stay
Okay.
away from the hot topics, time limited. There's something that you can connect with almost everyone. You can
Right.
find something to connect with because
Absolutely.
we all understand what that emotion feels like. We all understand what laughing and joy and sadness, and
Yeah.
connect with them on the emotional level on something, not heavy content,
Right.
but connect in that silly, fun, playful, or I understand what it feels like to be sad, whatever
Right.
that is, without going into the content.
Gotcha.
Make sure, so you want to stay away from content.
with this person.
Yeah, that's
Okay,
right.
okay.
So the lay term narcissist, which is everybody else in the world, and the gaslighters, all the things, almost kind of the same thing. We're time limited in how we
Right.
deal with them, and connect with them about something that they want to talk about.
Right.
Why not? It won't kill you for 10 minutes,
Right,
especially
to
if that
talk about
person's
them.
there.
Right.
Let them do it. They're happy. They're
Yeah.
going to be more jovial. They'll be more pleasant, and it doesn't ruin dinner.
Right. Good.
So why not?
Right.
And you're doing something for them. Altruism.
Oh,
See?
yep,
There
I
we
see
go.
how you
Do
did
see it?
that.
You
I
like
see
that?
how
You
you
like
did that. That was great. That was great. So great question,
Yes.
listener. Okay. we got her going. Okay, next question is, okay, this is a good one. How do you gain trust with someone when the trust has been broken over and over?
That's a
That
really,
is a
really,
good
really
one.
great one. Well,
It is.
I think it's determining if that person is worth fighting for to
Okay.
regain the trust.
Okay.
Right? Two major things, maybe two, maybe three, I can't remember, but the first thing is transparency in the relationship. So if the person has broken your trust, you are well within the right, if you're going to continue to work on rebuilding that trust, you are well within the right to ask for complete transparency, whatever that means, right? I think a lot of times whenever we think of trust being broken, we think of fidelity in a relationship. But it's not just that. It can
Right, it could be anything.
Parent-child,
Yeah.
right? Not showing up consistently. So trust is a factor of, we need consistent behavior, right? So the transparency that you ask for, and transparency, if it's not a fidelity situation, if it's parent-child or a friend, you can just say, just tell me what you think of me. Tell me what you're going to do. Tell me when you're going to show up. Tell me, it's not a control thing. It's just communicate with me consistently.
Okay.
Okay.
So
And
just that communication will build trust over time.
consistent.
Consistent is the key
Consistent
word.
behavior over
Over
time,
time.
builds
Okay.
trust. Depending on what broke the trust in the first place, you need at least 6 months of that consistent communication and transparency and behavior before you can kind of exhale and lean back in.
Yeah. I think that's good. I think that's good that you put a little time there. Time because people go, how do I know?
Right.
Like
Well, we operate in time, right?
When do I? Yeah, we do.
Right,
We,
right.
And so,
And so,
6
yeah.
months. If it is infidelity, what is your?
Ooh.
That's a whole nother
That's a whole
story.
thing about it depends,
Yeah,
right?
yeah.
It's going to depend. Honestly, and I'm not being flippant, that if it's an infidelity, please just go get therapy.
Okay.
Individual,
Right.
for both people
Yeah.
and couples,
Yeah.
really, because
Good advice.
that is just so intricate and so many factors play into that. The relationship dynamics, there's just a lot
Yeah.
that plays into that.
Good advice.
So-
Good advice. Okay, the next question is, phones. We live in a society now where we can't be without our phones, right? What effects do you think phones have had on children? Because
Oh,
we're
man.
both moms,
Right.
moms of 4, and we see how we all, and we're guilty too. We all have our phones at a hand's reach.
Constant.
Constantly. What effects has that had on children, and what can we do? Is it ever too late to make a positive change?
Right. Well, and that's a great question. And of course, studies are still out. The way that we do these studies, you've got to gather data for like decades, right?
Right.
To really know
Right.
the full impact. But they have some. Social skill development was very, very obvious, right? So
Right.
I don't know about you, but when these stupid phones come out, and my son is 19 now, and he was 12, I would have to tell them how to answer the phone, right? Like, cause
How to talk on it, not text.
How to talk on it, but then how to talk on it, how to talk to me, but then how to talk to someone in person too. Like, you have to make eye contact, put that phone down, shake their hands, right? And so we're giving more, well, we should be giving more direction to our kids about how to develop social skills. Our kids do not know how to interact socially with people unless it's through the phone. Right. So that is,
and like, that is not a relationship. Like, to me, that's the biggest thing, right? Like, if, like, a relationship is built over time. Again, consistency over time. This is going to be my new favorite, like, go-to. Consistency over time. That's right. But that's how a relationship is built. It's face-to-face, or it's talking, but just texting or snapping.
Right.
Sorry if you're listening right now. I was just pretending to take pictures with, a million selfies that we've all seen our children take in the backseat of the car. Constant. When you think they're talking to you, but they're really just back there snapping.
Exactly. They're not listening at all.
That is not a relationship, right?
It's really not.
So you're right. We've had to change how we teach them how to have a relationship.
We sure have. Okay. And we've changed what we believe relationships really are. It's amazing to me how so many people, and no offense to anyone that's listening, but people get emotionally involved through the phone with someone texting in a romantic way that they don't even know, have never even met, don't know anything about their life.
Don't know who that person is on the other side.
Never met them, haven't talked to them, but you're emotionally involved. The good thing about that shows that it doesn't have to be a physical connection. It doesn't have to be any of these things. And you can experience that emotion. But it makes me wonder about the reality of it, because how much of that is really your imagination? Because here's the flip side of that is, for kids, going back to your question, what I feel like I've seen, even in my own kids, is they have lost the ability to imagine.
Yes, downtime.
And that is,
downtime and being bored. Just to be bored.
Well, think about the importance of an imagination, right? It gets your neurotransmitters connected. It challenges your mind. You have to go beyond your boundaries when you're using your imagination. You're going beyond your typical boundary to create.
Yes.
We're losing our ability to create. Our kids are. The kids don't even play with their own toys. They watch YouTube watching other people play with toys. I know mine do that. I just don't even understand it. And it's the most annoying people and they're adults with these high-pitched voices playing with toys. And so instead of playing with the toys that
they're watching people play with toys.
Yes. And my kids will ask for that toy to play with it and then watch the video and not even play with it.
Right. That's crazy. It's like
it doesn't make any sense. Make it make sense.
Right.
Make it make sense.
I don't know how. I don't either.
But here's the thing. Imagination is so fundamental to our growth.
Yes.
Because we're all creative beings. God put it in us, right? And we already stopped using so much of our brain. So we lose the ability to imagine. Then we are losing our creativity. We're losing our vision. We're losing our path for our life. We're losing our ambition. We're losing our inherent motivation when you lose that imagination.
Wow. How do we get it back?
Turn off the phones.
Turn off the phones.
And I am not judging, because
And the PlayStation and the game.
And all the things.
Yes.
All the things.
And the video games.
My kids have all of that.
Right. We do too.
And when I am ready, when I'm done from working and I don't want to talk to anymore, including them, go get on your phone. Like, just leave me alone. Give me a minute. Let me watch the reality show.
It's like an easy go-to, right? Just say, go get on your phone.
It is.
Yeah.
And
We've
so
all done it.
Yeah, I'm totally guilty of it. But when my 8-year-old says, my phone's dead, I don't have anything to do, and I'm like, you have a whole room full of stuff, you've got all this gymnastics equipment, you have 2 other siblings that are here in the home with you, you have a dog, like,
read a book, play with the dog, go in the backyard,
exactly.
But you're right, the things that we would have done growing up, because we didn't have the phone,
all of that.
So I guess it goes back to my question: is it too late to change?
It's not too late.
No.
Okay. So what happens though is when our children are used to that phone, that tablet, that Xbox, and we take it away, their behavior escalates.
Yes.
I don't know about yours, but mine get annoying. Really annoying. And so then what do I want to do?
Give them the toy.
Exactly.
Or the phone.
Give it right back.
Give it right back.
Because I need my peace.
Right.
So you having...
So we have to take a stronger responsibility
We do.
to not be the go-to of using the phone as a babysitter.
Right. That
or technology.
And when we take it away or we reduce the time, we're willing to tolerate that adjustment phase. It's just an adjustment phase. Right. It might be a couple of weeks of an adjustment phase where their behavior escalates. But if you just refrain from that, they'll adjust back and be just fine, because kids are resilient. Humans are resilient.
Oh, yes.
We adjust very quickly to most things.
Right. I've given myself a timeout from the phone before.
Yeah.
I've just said, okay,
Sometimes,
too
you
much
have
screen
to.
time.
Exactly.
I'm putting this away.
Turn off the social media. One of the things that I really like is that the phones now will tell you how much screen time you have.
Yes, I love that.
You did an hour less this week or whatever.
You almost feel like, yeah,
I know,
you
do.
little flex. Yeah.
You do. And so
I used an hour less.
Exactly. Well, one of the things I've started doing is I reward myself.
Oh, good. I like that.
So I'm not intentionally trying to use it less, which I should be. Up here, I'm like, okay, I should. But I haven't made that step into that change. But when it says I've used it less, then I reward myself.
I love that.
I know.
I think I love the reward system. Yeah.
Me, I live off rewards. You can see it in my closet. I'm rewarding myself for everything. Oh, girl, you were breathing today. Get it, girl. Reward myself for that.
New shoes. I love that. But you have to do what works. Whatever's going to work.
Right.
And if the little incentive is a new pair of shoes or whatever it is, why not?
If you can afford it.
If you can afford it.
Because then we have financial stress.
All right, next question is... this is a good one. As a parent with anxiety, how do you help your child who is experiencing anxiety too when you feel like you can't even help yourself with anxiety? That's a good question.
That's a great question. And like I've already told you, I am a parent with anxiety, and I have a 15-year-old who was experiencing anxiety, and she was like, Mom, I need to see a doctor. And I'm like, hello? Like,
I am a doctor.
Okay, fine.
You've got me here.
So that's what we did. You got to go see a doctor.
Right.
I'm like, great. So I think what happens is, for a lot of us, even if we're struggling to manage ourselves, we feel as though we don't have the credibility to help someone else, right? But everybody needs something different. Just because I have anxiety doesn't mean what's working for me will work for you. Right. Just because you're my child doesn't mean what's working for me to manage my own anxiety or not will work for you. Or what I know
clinically has worked for others.
Exactly.
Because you are my child, so it's different.
That's right. So I think what happens is, when you are a parent with anxiety and you have a child with anxiety, please utilize your resources. If you can afford therapy, do that. If you can afford and they need medications, do that. But utilize the professionals in your life and provide that safe space, not private, not protected, that non-judgmental safe space where your kiddo can say, yeah, I'm really anxious about this. And it's not, well, you're going to be fine.
Right.
Why are you anxious about that? That doesn't make sense.
That's probably the worst thing you can say to someone with anxiety, right?
The worst thing. Why are you worried about
Why are
that?
you worried about it? You're
It's
going
so
to be
minimizing.
fine.
It's so minimizing. So as the parent, allowing them to identify when they're having the anxiety, help them understand what's causing it. So anxiety is it's a really interesting beast. Sometimes it's caused by nothing. It just comes on for no rhyme or reason. Yeah. And sometimes there's a real reason, right? But identifying, is this my chemicals in my body that's creating this? Is when it comes on for no rhyme or reason. Right. It's chemical, it's biology. And then, or is this caused by something? Am I anticipating a test? Or am I anticipating a first date with the boy? Or am I anticipating going to school and school's hard?
Or I have to see that person that maybe wasn't so nice to me the last time. And yes, it brings up the anxiety.
That's right. Or my volleyball game, or my football game, or whatever it is.
Whatever it is.
And so a lot of anxiety is anticipatory. So an interesting thing about anxiety, it's often a product of thinking too far forward or thinking too far backwards.
So stay in the present, stay in the now.
Stay in the now.
And that
because when you do that, what that means is now my thoughts are here and they're not there or there.
Right.
I don't have an ability to think about there or there because it's right here, and what's going on right now is not necessarily making me anxious.
Is there a tip that you would suggest when people are they've got that final or that volleyball game, whatever that is getting them anxious? Is there something they can do immediately to help relieve that stress?
Yes. So I call it intentional breathing. You'll hear all these box breathings, all these things, but I call it intentional because it makes you focus on your breathing. There's so many different breathing methods of how you can do it. But I believe in short and sweet, and I don't like some of the more complicated ones, even though they're extremely effective. It's just a lot to think about when you're already anxious. So like, what's the simplest thing? Right. So what I like is the slow, deep breaths in through your nose, out through your mouth. So you do those a few times, real slow, real deep, with your eyes closed because we take in information visually. And then after about 3 or 4 of those, imagining your lungs inflating and deflating. Okay. So if you're imagining your lungs inflating and deflating as you're breathing, your thoughts are going to that imagination. Okay.
I said I'm like getting room for the air.
Because what you'll notice that your body just. Yeah. And if we were doing
you instantly feel better.
You can. And you close the eyes so that sensory is not coming in, and you're imagining your lungs inflate and deflate. What you'll notice is your body just kind of does this.
It does.
What's happening internally is the cortisol levels going down.
From the breath? Because of the breath?
Yep.
Okay.
So that is automatically, so cortisol is our stress hormone.
Okay.
So when we're stressed or we're anxious, we're worried about something coming up, that just creeps up and up and up. And then we get tense.
Like this,
right?
yeah.
Yeah, and it builds in all this acid and all the inflammation and all the yuckiness that goes on. So it brings down that cortisol level.
Okay.
It allows your muscles to relax. What that allows then is improved circulation. So our blood and our oxygen is circulating, which means our organs are getting what they need.
Gotcha.
Right.
See,
They're not
again, it's
tense.
all correlated.
It's all. That's why
It's
I said it's not just mental. It's
no,
not
mental
just
and
mental.
physical.
It is. It's all
I
in
love
there
that.
together.
Thank you for
Yeah.
sharing that, because I think that's important. If there's something that, if there's one thing we can help with today, and that will help you
That's right.
in the next stressful, anxiety-filled situation, try it, and you never know, it
And
could
that's
help.
right.
And
Yeah, and a lot of times it does. But also too, I think one of the things that is the most important to develop is trusting yourself.
yeah,
Trust yourself. Remember, you're resilient.
right.
You know, you have
Get
spiritual
it, girl.
gifts. Get it,
Get it,
girl.
girl.
You're resilient. You have some spiritual gifts.
Yes.
Give yourself some grace, but trust yourself that you'll get through this.
Yes.
Whatever it is, you'll get through it. Whether it's dinner at Christmas with family, or a stressful exam, or a hard time in your life, or infidelity in your marriage.
Right.
You'll get through it. It's
Right.
You'll get it.
Gosh, well, I always tell my kids, breathe and believe before any major thing. I'm like, breathe and believe.
That's right.
I didn't know there was like some actual scientific
It's science.
evidence to
There
it.
is
So yeah, if
science.
you could call my kids and tell them that, that'd be great.
I can do
Mom
that.
kind of knew what she was talking about,
But
not
it's
always.
So true, but not always. But that's okay. You don't just this one time.
But
You
breathe
got
and
this- you
believe.
got
I
this
always say
one
breathe
time.
and believe, because
That's
I know
right.
that's what's helped
Mindset.
me in life.
It
is
is-
just breathing and believing.
Man,
Yeah.
mindset is so
Yeah.
powerful. My
It is.
8-year-old. Oh gosh, she's such a hot mess. She's my little savage maniac.
Oh,
But
I
she's
bet
me.
she's adorable.
She's so cute. But her
Oh.
personality is me 5.0. So like that's real difficult to deal with. But anyway, so she's got this level, this inherent competitiveness to her, which is really cool.
Right.
And so she wants to be Miss Gymnast, And
Oh, I love it.
Yeah, and so she was doing something in gymnastics and got so mad at herself, and she just would and this panic and this crying, and I don't have a good tolerance for that. I mean, because she's great at what she does.
Right.
But this full meltdown.
Right.
It's 8:00 at night. I just want to get home. It's cold outside. I'm a girl.
Right.
Get in the car and just stop.
So what'd you
And she
say?
wasn't. I was yelling at her. You don't want to take that. That's not the parenting advice. That's not where I'm going.
We're not
We're
going
not supposed
there.
to ask that question. but after I calmed down,
Yes.
and after she calmed down, I said, Corey, it's all about your mindset.
Yes.
You have to tell yourself,
Right.
like the belief, right? Believe part of your breathe and believe. It's all about your mindset. If you're telling yourself that because you made one mistake, you're just horrible, you can't do it, you're not going to be able to do it.
Yeah.
But if you tell yourself you can, before you get out there, you're going to be able to do it.
Right.
So 2 weeks goes by, and they're at the little gymnastics class again, and they have a handstand. I'm so bad with these terms. Handstand competition. And so she's this little bitty thing, and all these older girls are in there where she beats all of them. And I was like, good job, baby. We're celebrating it, and we get in the car, and she's just smiling, and
Right.
she's missing half of her teeth, but she's got this smile on her face. And she was like, Mom, I thought about what you said. And I just said, before I did it, I said, I can do this. And she said, and then I won.
Oh.
So if an 8-year-old can do it.
Yes, you can too.
That's right.
I love
'Cause
that.
It really does
It does work.
It
I
works.
believe that
Yep.
100%.
Yep.
Love that.
It works.
Okay, last one from our questions here. Tips on parenting adult children.
Ooh, I need those myself. I have a 19-year-old, and
Right there,
the
we're in the
struggle
throes of this, aren't we,
is
sweetie?
real, especially now. So mine is coming home for a month. How are we gonna do that? Coming home for a month for college, or 19-year-old. Okay, so I don't know specifically what the question is, but I think it's important.
I think it's just in general. It was in general best tips on
Yeah.
parenting, and in general. Yeah.
So here's really where I am with that. I mean, I'm there personally, so you just kind of beat me up all side of there. Like, what am I supposed to do? They always say in therapy, like, what you're struggling with will come sit in front
It's
of
true.
you. And
It's
so that
so
question
true,
is
isn't
right
it?
there. Like, oh my goodness,
Yes.
he'll be home Friday.
Yeah.
So I think what happens is we continue to parent when we need to guide and support.
Yeah.
So maybe you don't parent anymore.
Right. It takes on a different role.
Yeah, if they're
Yeah.
adults, you know what I
Yeah.
mean? And so you'll always be the parent,
Yes.
which to me that always means, hey, I can pull rank and be like, I'm mom, I'm going to ask the questions, I'm going to tell you my opinion,
Right.
but I don't get to tell you what to do anymore.
Gotcha.
There's a
Because it's up to them. They have to make
You
their
gotta
own
make a
mistakes. They
choice.
have to make their choices.
Got to make a choice.
And they have to learn from them.
That's right. And so now I'm
it's more of a
guiding.
taking it back and guiding. Okay.
Yeah. So from parenting is the structure, and I'm instilling the values, and I'm fixing behavior, right?
Yeah.
Because I can when they're little and under our house and not 18 and not self-sufficient and all of the things. When they're an adult, you will get iced out if you're still parenting.
Right.
We're guiding and supporting emotionally. Now, if they're doing things, have bad behavior, don't support them financially.
Right.
Right? You can pull that off, but you can always still support emotionally.
Right.
Right? And so you create, like we've talked about, the safe space for them to come to talk to you, to tell you their stuff. And let me tell you something, if you create that, they'll come.
Yeah. For
My
sure.
19-year-old is an oversharer. Sometimes I'm like, I don't want to hear this. I love him to death, but I'm like, oh.
You're like, that was
what?
too much information.
You realize I'm like, Mom, right? Like we're not like cool like that, like, right? Oh my goodness.
But that's a good thing.
But I would
It
rather,
is, yeah.
I'd rather know than not know, and it
Yes.
shows me that he trusts me, and I've created that space. You know,
Yes.
sometimes I'll walk away and be like, I need a drink. Oh my goodness. But we can have that dialogue.
Right.
But that also has created the space for me to now guide him.
Right. I
You
love
can't
that.
guide if you don't know what you're guiding.
Right. Yeah.
Right,
That's
what direction
so true.
and what direction they want to go.
That's so true.
So allow them to talk to you. Meet them where they are. And all your adult kids, if you have more than one, they're going to all be in somewhere different.
Yes.
And need something different at the exact same time.
Yes, at the exact same time. Isn't that amazing how that works out?
That's what I've heard. I've heard
It's
that.
so
I haven't
true.
experienced
Yeah,
it,
you're
but
not
I've
there
heard
because
it.
you only have one adult
Right.
child yet. Yeah. But it does happen.
That's
all
what
at
I've
the
heard.
same time. Car issues.
Right.
Their cars all break down at the same time.
I've heard that before. So,
Yeah.
but creating the space for
I
them
love that.
to say that. And then one of the things that I had to train my mom to do is, do you want my opinion or you want me just to listen?
That's good. So ask.
Ask.
Ask them.
Do you want my opinion or you want me just to listen?
That's good.
And they'll tell you, I just want you to listen. Cool. Well, guess what? That takes the pressure off,
Yes.
right? Because now I don't have to fix it for you. I don't have to tell you something and hope you're going to do it and
Right.
then get frustrated when you don't.
Yes.
All I have to do is be like, okay, I get it. I
I
hear what
love
you're
it.
saying.
Yeah. Okay, we're
Frame
gonna
that
we're gonna
conversation.
take this advice.
Yeah.
It's
Yeah.
gonna be great.
Oh, yeah.
It's gonna
we
be
got to
good.
take my own advice.
Right.
Right.
You gotta take your own advice.
There's a mom and son on TikTok. I know we just talked about getting off social media.
That's okay. But we still have to
part
live
of
with
my
it.
reward
Yeah.
system is TikTok,
TikTok.
right? Every once in a while. I'm really not a big TikToker, but there's a mom and son. I guess they have a pretty big following. I don't know. That's how much I am not really involved, but they have this little segment that they do called "We Listen and When We Don't Judge,"
Oh,
and they're
I love
both
that.
telling each other. It's fun and
That
silly
is
the way they
fun.
do it, but they're both telling each other something that they didn't like about each other. Whether it's what they wore or this thing you never found out about that I did. I mean, and
Right.
it's really entertaining and funny. But the tagline of "We Listen and Don't Judge," I like that.
I like
was
that too.
That's
I
what
like
we
that.
need to instill in our
I always say
homes.
love more, not judge more, but I
Yes.
love
Yes.
that.
Yeah.
Yes.
Yeah. And so if we instill that in our homes and our kids more so than you get a trophy for everything,
Right.
but more of you can come talk to me and I'm going to listen and not judge you.
Yeah.
It doesn't mean I'm going to like your behavior, right?
Right.
But I'm going to listen and not judge. And so while they're children, actual children, then we're guiding and disciplining. We're not punishing them. We're
Right.
disciplining, which means we're molding their behavior, right? Punishment
Right.
is we're taking their stuff away and you did bad. And discipline is we're training them how to act. As the adults, we've already done our job.
Right.
We've instilled the values.
They know right from wrong.
They know how to
what-
behave.
Right.
They
right.
know how to behave, right? So then they're actively choosing not to when they're, but okay, whatever. But
Yeah.
we listen and don't judge, then we can guide.
Yes, I love that.
Yeah.
Well, and how are we doing on time? Oh,
Time to go. Do I have a meeting? He's
he
like,
says
stop
the
talking.
time. Because I always want to be respectful of your time because I want to
Sure.
make sure we get you to your next place.
Oh,
and yes, we are.
perfect
We're
timing,
getting a
yeah.
little closer. We do a fun thing really quick called favorite things.
Okay.
And so it's almost like just fast answers.
Oh,
So-
goodness
So the
gracious.
first
Okay.
thing is favorite book.
Oh my goodness, there's so many of them. Make your bed.
Oh, I love that
Yeah.
one. I give that one
Yeah,
for
'cause it's-
graduation gifts.
It's so easy and it's easy
Yes.
to read. Oh, and the energy bus too. I mean, because that's work dynamics, but those are I like easy, simple
Yes,
reads.
I agree.
Yeah.
Okay, because we're busy with 4
Right,
kids.
I know,
so it's
I
like,
know,
we don't
I
have time
know.
to read.
And I like fiction
Okay.
books too, but there you go.
Okay, favorite podcast.
This one.
Oh, thank you.
I don't really listen to a ton of podcasts, believe it or not. I listen to Audible, but yeah.
Oh yeah, I love
but I've
Audible.
listened to this one. So
Well,
this is-
thank you. I appreciate that. Favorite movie.
Pretty Woman.
Oh, me too. I love
Do
Pretty
you-
Woman.
do you
I
really?
love Pretty Woman. I can watch it
That's
over and
so
over.
my jam.
Over
I
and
have.
over.
Yeah.
Over. And
Yeah.
I have too.
I have.
Yeah. Okay. Favorite restaurant in West Texas.
Oh my. Because I am a foodie. I eat literally everything
You-
though.
you love
I
it all?
do. I don't have a favorite.
No favorite that stands out. Okay. Favorite coffee shop.
I make my coffee at home. I'm so lame.
We do too. I mean, I love them all. I've occasionally gone and I will go.
I
Like,
go
love
for the
Far
vibe,
West. I love the
though.
vibe. Yes,
Yeah, I go for
yes.
the vibe, not for the coffee.
Right,
Yeah.
but yeah, we make ours at home a lot. Too.
Right. Yeah. I'm just at home. I'm a homebody, so I'm really lame.
You're not lame at all. You are busy. You're happy to be home. That's how we are. We're like, we're home today.
Thank you,
Yay.
Jesus.
Okay, favorite hype song. You're walking in a place, what song's playing in your head?
Oh, that's good. Because I love music is totally my jam. You put me on the spot with that one. All I Do Is Win.
I love it. That's on my running playlist. That's on my running playlist.
I'm telling you, I gotta hype
love it.
myself up for something.
That's right.
These days, but I like Khaled. I mean, I like so many different.
Yes.
Imagine Dragons. I mean, I like them all. So.
I love All I Do Is
Yeah.
and Don't Stop Believing's mine.
No,
That's my.
I like that.
If I need a little
exactly.
something in there. Okay. Favorite life hack, something that makes your life a little easier.
My mom. I know you can't have her though. My mom makes my
But
life
that's
so
beautiful.
much easier.
I
She's
love
amazing.
That. I love that. That is a great life
I don't
hack.
have any real hacks. I just have her because she hacks it all for
I
me.
love that. That's
Yeah.
beautiful.
Yeah.
That's awesome. Favorite. Okay, this is a fun fact about you that we would not know reading your bio.
Oh, well, you know about the 4 kids. So I'm a homebody. I told you that. But I do have a little bit of a wild side.
Okay.
Yeah. So I like live music.
Yes.
And I will be the only one dancing.
I love
I
it.
don't care. I just
What, you
have
know
this
that
freedom.
saying, dance while, like no one's
That's
watching?
right. Yeah, that's
Are
my
you one of
jam.
the- I love it.
I am. So
I love it.
but I like live music. I like amateur bands, right? When it's not perfect. I
Right.
like it a little bit to be off. And
Yeah.
There's
So
the
you just
feeling
sit
of
back and just-
authenticity.
Yes.
But remember, I don't sit. I'm
Oh
the one
yeah,
up.
you're dancing. You're dancing. You're not sitting. That's right.
So the one night that you might catch me out, every 2 months or so.
I love that.
I'm getting my jam on.
That's
Yeah,
great.
yeah.
That is a fun fact. That is a fun.
I love
and I
it.
think the world needs to dance more.
I
really
too.
do. I mean, dance.
We
dance
do.
while no
We
but-
dance at home all the time. Me and the kids do karaoke all the time, and my
That's
mom does
fun.
stand-up comedy, and her jokes are terrible. And then, so when we're done listening to her terrible stand-up comedy jokes that she's the only one laughing at, then we do karaoke and we dance and do all of that.
Oh,
But
I want to come to your house. That
it's
sounds like
so
fun.
fun. It is
That is
so
awesome.
fun. Yeah,
That
yeah.
is awesome. Okay, favorite memory in Midland, and that'll wrap up our favorite things.
Oh, my baby's being born.
Yeah.
Yeah.
Yeah, nothing beats that.
Yeah.
That's
Nothing.
it.
Yeah.
Well,
that's
thanks
it.
for playing favorite things.
This was
that was
so
fun.
fun.
I want to close out by just, first of all, just saying how amazing I think you are. The tips
That's
you
so
shared,
sweet.
your
Thank
authenticity is just off the charts. I mean, I just love getting to know you better, and I love what you're doing for our community. Is there anything that we didn't get to talk about that you're like, I hope they learn this about either me or what I'm doing here or what's happening in the mental health community?
Well,
before we
I
close out?
think we could have part 2, 3, and 4.
I think we could
love,
too.
I love the questions because
Thank you. Yes,
that
that was
allows us to
fun.
connect with the audience. But
I agree.
Parting notes, I think, just really for people to understand, realize your spiritual gifts, lean into
Yes.
those, trust yourself,
Yes.
because then it makes whatever you're dealing with as far as mental health, it makes it more tolerable. It doesn't
Yes.
make it go away, but
Right.
it makes it more tolerable, and that's the key.
Well,
Yeah.
I think that was a perfect way to end things.
good.
I've so enjoyed this time together. I look
was
forward to
so
part
fun.
2 and 3 and
Okay.
4. We are going to do that, and we're going to be updated as the Behavioral Health Center.
Yes,
I
yes.
would love to do that and do some follow-ups. But thank you for what you're doing. Thank you for sharing your gifts, because I
Yes,
think there's
thank
nothing
you.
better when you can tell when someone is truly doing what they love to do and are sharing their gifts. So
It's honoring.
congratulations.
Thank you. It was an honor
And
to be here.
thank you all for listening. What a fun day. I enjoyed this so much. I hope you did too. Share this with someone that you love. Share this with someone that needs those tips from those questions that we talked about. But most importantly, just keep on, doing the things, the good you're doing in your life. We believe in you. Don't forget to dream big, believe, and never give up. And I just want to thank you and all of our sponsors for being here so that we can continue to share the amazing stories like Dr. Stephanie Caples. So let's continue, and we'll see you next time. How does that sound? All right. Thank you so much. You make it a great day. Bye-bye.